The South African Medical Research Council is calling for more funding. The calls have been reignited by the significant disparities confronting health research in the country. These disparities have led to a huge gap in skills capacity in that fraternity. To discuss, I'm now joined by Prof. Petro Terblanche, who's the CEO of Afrigen, and Prof. Mushi Matjila, who's the head of the Department of Obstetrics and Gynecology at the Groote Hospital. Thank you so much, both to you, Profs, for joining us this evening. Let's start with you, Prof. Terblanche. Just talk to us about these significant disparities in health research, development and innovation that Africa is facing, and what are the key areas that you think require urgent attention?
Good evening, Katlego, and good evening to South Africa. It's a pleasure to be on this program this evening on a very, very important issue. Fostering research and development capabilities in a country is one of the lifebloods of any society. And without a sufficient investment of long-term and not subcritical investment in research and development, it's very difficult to build a fully vertically integrated economy. And in South Africa and across the continent, despite numerous efforts due to multiple factors, including priorities, how funding for research is still less than 1% of GDP. In fact, for the continent, it's less than 0.5%, and for South Africa, it is 0.5%. So without that, it is almost impossible to build a strong research culture, build facilities, sustain long-term research programs focusing on solutions for our economies. That means that we have to leverage research from international funders. And in fact, on a positive note, South Africa has been quite effective in doing so, and I think Prof. Matjila can also vouch for some of that. South Africa, of research and development funding coming from international sources, South Africa leveraged the most on the African continent, I think at about 36% of those funds. But that means in many cases that we are donor-driven research. We're doing research where the priorities is determined internationally and not necessarily locally. And during the COVID pandemic, it was again demonstrated how important it is for South Africa and the continent to invest in end-to-end research, development, and manufacturing capabilities so that we are not only pandemic prepared, but we also interpandemically have the capability to address health problems on the continent and in our country. So we have to leverage local investment by private sector and public sector and government in addition to sourcing international funding for our research.
Prof. Matjila, just on that note that Prof. Petro has just made with regards to our research being donor-based and therefore the objectives being that for donors. From a public health perspective, what impact do you think this disparity in the lack of research funding has on public sector health users?
Yeah, so thank you very much indeed, and thank you for the invitation, and good evening to your viewers and fellow Prof. Terblanche, who's here with me. So it's an important question. I think she's already raised it. I think it is a concern that you are so dependent on external funding to drive your research, and potentially what that can have is that the donors can have their own ideas about what is priority to fund in terms of the research. It might not necessarily align with what the priorities for the country are. But having said that, there have been efforts, for example, by the Medical Research Council, where they've actually brought all the international donors together, and they've said, for example, to the NHRC, which is the National Health Research Committee, which I chair, and some of its mandate is actually to say to ourselves, actually, what are the important areas to focus on in terms of research, and therefore in terms of streamlining the funding. So the MRC have brought these donors under one roof, and they've said, well, they've invited us and said, well, can you tell us what the priorities are? And, you know, as a country and from a public health perspective, as you know, 80%, more than 80% of the country's population are dependent on the public health sector. And so we've identified these and these, of course, continue to change over time. But we largely have 4 burdens. And the one is that communicable disease, so infections, TB, etc. Non-communicable disease, which is diabetes, which is and hypertension, and so on. And then, of course, you've got a high burden of maternal mortality and perinatal mortality, which is babies dying in pregnancy, but also small babies dying. And the last one is deaths due to violence and injuries. So, and that's largely driven by things like alcohol and so on. So that largely defines our burden, and that's what should be driven. That's what should drive where the resources go. But as I said, I think efforts are being made to channel the external funding to the areas of burden.
So, Prof. Terblanche, still staying on the issue of local funders, is it a lack of having an accessibility in terms of the funding from local funders, or is it a lack of a will for them to want to fund health research projects?
I think it's a challenge of priorities. It's a factor of economic growth. A country that has low figure of economic growth it's very difficult for those economies to invest in research and development, because the priorities is healthcare and the priorities are infrastructure and social grants. And I think on the African continent that is very visible. Therefore, we have to create, as a government, also policies that will incentivize private sector to invest in research. It's only when we combine the public and the private sector and we leverage international grant funding from philanthropic organizations or other international governments which South Africa has done very effectively in the last 3 years. It's only then that we will be able to put a pool of funding together that sustain research. And as Prof. Matjila is saying, we have a triple or a quadruple burden of disease. And the research is not only around understanding the epidemiology, understanding the healthcare systems that will support that, but also to do product development, localized product development for local manufacturing. Because one of the key multipliers for economic development is local manufacturing. But local manufacturing also requires research in process development, process improvement, energy improvements, and most of all, products that can be locally manufactured. And if we bring all of that together in a partnership model with a clear strategy to bring innovation, because this is ultimately about innovation, into the South African economy. If we don't do that, we're going to really, really struggle to move our investment in research and development above 1% of GDP, which is the goal.
So, Prof. Matjila, just on that point with regards to innovation and then not being able to have these projects funded adequately locally, what impact does it have on skill?
Yeah, so you raise an important point. I mean, so we need to think about where we're going to get our next generation of researchers as we move forward. So capacity development in terms of ensuring that generation of those who are going to generate the new knowledge is an incredibly important aspect. And it's one of the issues that the National Health Research Committee is critically invested in. And so there have been many efforts, and one of them is the Bongani Mayosi, the late Professor Mayosi's National Health Scholarships Program, which is funded by the government through the Public Health Enhancement Fund, but also through the MRC's findings. So jointly, it's administered by the MRC, and so. It is critical, and it's important that we invest across the country, so that you're not finding particular institutions generating that kind of capacity, whereas others are left behind. I think we are quite concerned and quite intended at the fact that we should be generating the knowledge from across the country, from all institutions.
Of course.
Yes.
Prof. Terblanche, just how does Afrigen fit into the landscape of health research and innovation in Africa? And just what specific contributions is your organization making to address these disparities?
So Afrigen is one of the very few biotechnology startup companies on the continent. We are based here in Cape Town, and that's where I'm addressing and participating from. We are an mRNA technology transfer and development hub for the World Health Organization. And Afrigen contributes to skills development and innovation, we can talk in a minute, in the following ways. We have grown our staff complement since 2021 from 22 people to 156 today. These are highly skilled vaccine research, development, and manufacturing individuals, a scarce skill on the continent. And we have trained those people. We've trained them locally, internationally. Because of South Africa's strong research base, we were able to recruit locally only, but then expedite the training of those people so that we now have a core of biotechnology excellence contributing to innovation broadly. But what we also do is we bring interns into our organization from universities such as University of Cape Town. We participate in the South African Medical Research Council Skills Development Program, where we give workplace experience to young professionals that wants to work in the biotechnology sector. So critically for us is the partnership with the universities, that we contribute to practical work, but also that we feed back to the universities. Because when we started our end-to-end platform, which is unique on the African continent, we identified gaps in skills development and training that exist in the South African economy, which we'd have never identified without establishing these platforms for end-to-end vaccine research, development, and manufacturing. And that allows us to make contributions to directed skills development, such as, for example, production pharmacists. We have fantastic pharmacy schools in South Africa, but none of them train for industrial pharmacists. We train for retail pharmacists. That's one simple example, and I'm sure Prof. Matjila can mention a number of other examples. So again, we need to train for gaps. We need to complete horizontally the needs of a country in our training and skills development program so that we move forward, not only the research we do and the outputs, but also the economic development.
Prof. Matjila, just to close it off, what do you find to be the low-hanging fruit in solving this problem?
Yeah, so before I say that, so I think we must be data-driven in what we do. And one of the key really pressing issues at the moment is the issue around universal health coverage. So this whole idea that, in fact, access to good quality healthcare shouldn't just be dependent on the socioeconomic status. And so that should be informed. I mean, what we really lack is research, community-based research, for example. You know, things such as what is it that informs our population to do certain things? What is it that informs health-seeking behavior, for example? What drives the pattern of food? Because that contributes obviously to the burden of disease in terms of non-communicable disease. So those are the low-hanging fruits in terms of understanding our communities better. But also, I think, as I said, you know, channeling all the resources in the direction of what it is that will make, you know, a South African walking the street in a much better health. And these we know. I mean, the social determinants of health, we've always known that these are the conditions in which people are born, they grow up, they live, they age, and ultimately die. And these impact hugely on health. And these are not some of the things that we necessarily need to understand better, but these are things that we can begin to implement if we are effective. Yeah,
most certainly.
Thank you.
All right, thank you so much for joining us. That is Prof. Petro Terblanche, who is the CEO of Afrigen, as well as Prof. Mushi Matjila, who's the head of the Department of Obstetrics and Gynecology at the Groote Schuur Hospital.